PCOS breakthrough that's making doctors rethink everything about this condition. I know if you have this right now that you're puzzled because nobody has an answer for you. Boston Children's Hospital published research in January 24 showing that genetic risk factors for PCOS show up as early as age 6. Girls who carry the PCOS genes already have higher body fat percentages and insulin resistance from childhood, long before their ovaries are even active. Which means for years your body was sending metabolic distress signals, signs that insulin resistance was developing. But PCOS typically isn't diagnosed until your mid to late 20s, when you're struggling with irregular periods, weight gain, facial hair, and then you get birth control pills or metformin. What the research is confirming is that PCOS isn't just an ovarian problem. It's a whole body metabolic condition that's driven by insulin resistance, inflammation, and probably some genetic predispositions. And the metabolic dysfunction starts in childhood. Imagine if you would have had a chance to prevent this. The ovarian symptoms, those come years later. They're a result of years of elevated insulin forcing your ovaries to overproduce those male hormones. Birth control and metformin address symptoms, but they don't correct the underlying resistance to insulin. And in some cases, birth control may even worsen your insulin signaling. So what addresses the root causes? You have to tackle insulin resistance directly. And this is a controversial conversation in of itself, but for us, what we do very successfully is our approach with GLP-1 medications comes into play. Research shows GLP-1s significantly improve insulin signaling. They reduce inflammation and they help with weight loss, specifically in PCOS patients as well. And we combine this with therapeutic flow fasting, strategically timed to produce even lower levels of insulin, while specific weekly long fasting can help drive the needle even more. More research in PCOS is needed, but this is very promising. Patients in our clinic with PCOS, they're seeing improvements in their cycles, hormone levels, sustainable weight loss, because we're addressing the metabolic dysfunction that research is now showing starts in your childhood. So if you have PCOS and conventional treatments aren't working, then this metabolic approach might be exactly what you guys need. If you have any questions, you know how to reach me.